Welcome and thank you for coming to this talk today on how we can reduce our risk of falls with the help of occupational therapy. My name is Katie Kelly and I am a student at the University of Southern Maine in the Masters of Occupational Therapy program. And I want to talk to you about falls because injury caused from a fall or even the fear of falling itself is going to keep us from engaging in the activities that give our life meaning, and that is where occupational therapy can come in and help. We want to make sure that you are continuing to engage in the necessary and meaningful occupations of your life while remaining safe. Falls are the leading cause of injury and accidental death in adults over the age of 65, but good news, there's a lot we can do to prevent falls. Most of the time, falls are occurring because several risk factors are happening at once. So we need to identify these risk factors. And what are we talking about? We might be talking about physical risk factors. And this is just changes in our body that increase our risk for a fall as we age. So we might be talking about balance. We're talking about medication interactions. We're talking about impaired vision. If you're on medications, very, very common. We want to talk to our doctor and pharmacist about the interactions we might be having. So if a medication is leaving us feeling fatigued or dizzy or confused, this is something you want to let your provider know because chances are they have suggestions or changes that can be made. Oftentimes, a common symptom of medications is dehydration. So another easy way to make sure we're not feeling too dizzy or confused leading to falls is staying hydrated. As far as our vision goes, our vision changes as we get older. It can be hard to recognize some of those changes as they're occurring. But if you're having difficulty judging how far something is away from you, it's going to be difficult to safely navigate your environment. So an easy modification, let's just make sure we're having our vision checked regularly by a healthcare provider. And let's remember that exercise and sleep are really important to our eye health. And lastly, balance. Balance isn't something that you're just born with and you can't change it. There's actually a lot of evidence-based practices out there that can improve our balance, such as Tai Chi, moving for better balance, or Matter of Balance. And these are all going to safely improve our balance and our skills during day-to-day activities. Behavioral risk factors. Behavioral risk factors are simply things that we do or don't do that might increase our fall risk. Every person has the ability to make decisions about how to engage in activities to be safe, and sometimes we might need to plan ahead or modify how we do things to take advantage of our strengths or compensate for things we are no longer able to do as well as we used to. What might this look like? We might want to ask someone to drop us off at a door instead of having to navigate the icy sidewalks. Or maybe we call ahead to a restaurant and ask them, hey, do you have, a ramp accessible access instead of stairs? Because right now stairs just aren't a safe option for me. Again, these are behavioral changes that we can make to improve our fall prevention. And finally, environmental risk factors. Sometimes these are easier to identify, sometimes they're a little trickier. They could be our home environment, it might be the community environment. So, throw rugs in our home, we can easily get rid of them. If you don't want to get rid of them, we can anchor them to the ground. We can improve our lighting in our home so it's easier to see. We can make sure all extra extension cords are tucked away and not under our feet, causing us to trip. We can make sure we're cleaning up spills as soon as they happen to reduce our risk of slipping. Bottom line, sometimes stuff happens, so if you fall, what can we do? We can have a plan. We can have a plan made out. So, if you fall, bang as loud as you can on the ground, bang on the walls, yell, shout for help, and then make sure you relax and take breaks because getting all worked up is only going to increase discomfort. If you fall and you're not hurt, we can actually have a plan to roll on our side, get up on all fours, rise up to our knees, and then find a stable surface to pull us up. Bottom line, you have to be your own biggest advocate. So we need to talk to our physician and pharmacists. We need to get regular eye exams. We want to stay active and exercise. We want to find alternatives for potentially risky behaviors. We want to maintain a healthy sleep and stay hydrated. And we want to identify hazards in our environments. You are the only, you're the best advocate for yourself, and just make sure that you are feeling comfortable at talking about falls because it's something that we can improve.